Doctors and defense attorneys, what are medical malpractice considerations and some standards of care to know regarding TEE use? Patients and plaintiff attorneys, when does TEE commonly lead to litigation? We'll cover all that and more in this episode of Tea Time. Welcome back to Tea Time. I'm Dr. Andreas Plakis, and in this episode 18, we're going to be discussing TEE and medical malpractice considerations for doctors, attorneys, and patients. The clinical question here is, how can physicians, attorneys, and patients better understand the medico-legal implications of TEE procedures? The reason we're getting into this topic, aside from it being requested a number of times, is to bridge clinical practice and the medico-legal implications and responsibility related to TEE. From a physician's side, understanding risk mitigation and being aware of the risks involved. For attorneys, understanding the standards of care regarding TEE practice. Then regarding patients, it's important for patients to know the informed consent process related to TEE and understand the risks, benefits, and alternatives to the procedure. Some of my background is I do perform medico-legal consulting for anesthesia and cardiac anesthesia legal cases. However, this podcast is for informational and educational purposes only. It is not personalized medical or legal advice. However, if you are an attorney that needs help with anesthesia cases and TEE-related injury, or a physician that needs an extra opinion, feel free to reach out. I put this contact information here if you need extra assistance. So let's start real basic. What even is transesophageal echocardiography? Well, if we break down the word itself, we can gain a better understanding of this. Trans meaning across. Esophagus is the location of the TEE probe. So essentially the esophagus is where you swallow food before it travels down to the stomach. So the TEE probe that is used from the procedure goes into the mouth, down into the esophagus, and even into the stomach when it's performed. So that's transesophageal. And then echocardiography. Echo, where ultrasound technology can be used to produce sound waves that help produce images. Cardio is where you use these sound waves to image the heart. And then ography, the graphy part of this, is drawing or creating images. So the big summary here is, while the TEE probe is located in the esophagus, you can use ultrasound sound wave technology to create images of the heart for further evaluation. What's unique here about TEE is that the esophagus sits directly behind the heart. So this can provide very detailed images of some of the structures that may be hard to see when you have a TTE. TTE is performed on the chest wall, so a patient does not need to be sedated for these like they are commonly sedated for a TEE procedure. When is TEE even used? Well, there's a lot of different guidelines on this, but in brief summary, it's when further cardiac evaluation is needed and you're unable or unlikely to obtain the information that you need with transthoracic echocardiography, or TTE. Some of the settings it's used are in a cardiology evaluation, either in a hospital or in an outpatient setting. Intraoperatively, if we're having cardiac surgery performed, some electrophysiology or cath lab interventions, and then even high-risk non-cardiac surgery operating room settings. And then outside the operating room, we're seeing it used in emergency departments as resuscitative TEE, ICUs, and even in-hospital cardiac arrests as well. Let's discuss a few of the components of informed consent for TEE. Remember, we're thinking risks, benefits, and alternatives to the procedure here. When it comes to the benefits of TEE, generally what you'll get with TEE compared to TTE are improved image quality, and especially some of the posterior or deeper structures of the heart that are harder to see from the chest wall. You'll get this detailed cardiac evaluation. Also, it's used intraoperatively during cardiac surgeries to evaluate success. It's used in other procedures, especially in a cath lab environment, for active procedural guidance. And then in many different settings, it's helpful as a monitor to optimize hemodynamics. If a patient needs fluids or medications to help improve their blood pressure or their cardiac function, this can help guide those decisions. What are the risks in addition to the benefits of TEE? Well, this image summarizes them wonderfully, that you can think from oral to oropharyngeal to laryngeal, esophageal, and gastric. As you place a probe, it can cause dental or lip trauma. Then as you advance that probe in the oropharynx, which is the back of the mouth, it can cause laceration or even perforation of some of the tissues. If it goes into the airway instead of the esophagus or the food pipe, it can cause vocal cord trauma or airway compression or airway injury. In the esophagus, it can cause laceration, perforation, or false passage in this setting. And finally, in the gastric region, you can see bleeding, perforation, or lacerations as well. Are there some settings where you may want to avoid TEE? Some of the absolute contraindications that are listed are if you have a perforated viscus, which basically means you could have a ruptured esophagus or gastric region. If you have pathology in your esophagus, such as a strictured tight region, a tumor, or other problem that may make for an unsafe passage of the TEE probe. If you have active bleeding in the esophagus or stomach, recent surgery to those regions, or major surgery in the past. Some of the relative contraindications are important to note because you'll always evaluate the risk versus benefits in these settings. Would the information you could obtain from TEE be more valuable than the risks if a patient has one of these conditions? If you want to look further at some of these contraindications and how they are looked at in detail, check out episode 3 of this podcast for more in-depth analysis of some of these conditions. And the final component of informed consent are looking at the alternatives to a TEE procedure. The first of these is always to do nothing at all. And then some of the other procedures that could be performed are TTE, which we already mentioned. If you're in a cardiac surgery environment performing epicardial or epiaortic echocardiography, ICE or intracardiac echo, or even using smaller or new pediatric TEE probes to avoid injury to the esophagus. Let's talk about some of the medical legal components. Medical malpractice is understood as when a healthcare professional, through either a negligent act or omission, deviates from the standard of care, causing harm to a patient. To prove this, plaintiff attorneys will have to prove 4 key elements: duty, standard of care, causation, and harm. Duty is when a provider has a legal obligation to provide care for a patient. Standard of care is defined as the level of skill and care that a reasonably competent healthcare provider in the same field would have used under similar circumstances. An expert witness is used to help understand the standard of care in these environments. Causation is understood as the direct link between the healthcare provider's breach of the standard of care and the patient's harm. A but-for statement is used to help understand causation. Let me use an example of this. The patient would not have died but for the inappropriate use of the TEE probe. Harm is understood as the negative outcome a patient suffers. And this can be physical, it can be financial, economic damages, or it can be emotional or psychological non-economic damages. Let's look more closely at some of the literature we have regarding TEE and medical malpractice. This article was one specific to anesthesiologists, as the data source was from the American Society of Anesthesiologists, AQI, or Anesthesia Quality Institute Closed Claims Registry from 2000 to 2011. There were just over 2,500 total closed claims, and 71 of them were flagged by text search for transesophageal echocardiography. The inclusion criteria out of those 71 was TEE performed by an anesthesiologist and a malpractice claim related directly to TEE performance or interpretation. The final sample out of over 2,500 claims involved 13 cases. 10 of these were related to esophageal injury, 2 of these were related to diagnostic error, and then 1 other case. Esophageal injury was further delineated as 6 of them being tears, 2 perforations, and 2 bleeds, with 6 patients having died. Some of the major takeaways from this for anesthesiologists are that malpractice claims really are very uncommon when performing TEE by anesthesiologists, despite how common they are and how widespread their use. Esophageal injuries are the primary driver of malpractice claims as well, and then cases involving misdiagnosis where a provider missed valve pathology or also misinterpreted an artifact as an aortic dissection, leading to unnecessary surgery. This emphasizes the importance of caution in certain esophageal conditions and also being appropriately credentialed and trained to interpret the images that are seen with TEE and how they may influence clinical care. Another major paper that was published in the Journal of the American Society of Echocardiography in 2019 was looking at cardiologists specifically and their practice. And this was performed as the data source being a large U.S. national physician liability insurance company. The study periods were 2008 to 2013, and the number of claims that were analyzed were 480 that were all cardiology related. The TEE specific claims out of this 480 were just 8 claims, with none of those being transthoracic echocardiography. There were 3 themes seen among these claims as the most common reasons for litigation. This was number 1, the failure to order or perform TEE. This was 3 of the claims, where a delayed or absent TEE in high-risk patients, especially with endocarditis, led to a misdiagnosis or even death of the patient. Number 2 was failure to screen for contraindications. This was 2 of the claims. One example they gave was quadriplegia that occurred after TEE in a patient with undiagnosed cervical spinal epidural abscess. This patient had neck pain, fever, and neurosymptoms and was not evaluated by neurosurgery or neurology prior to the procedure. Finally, technical performance errors were the final result of claims such as esophageal perforations, a retropharyngeal abscess, or improper technique during TEE use. Some of the takeaways here are: conduct a pre-TEE screening. This can help you ensure that you're not placing the probe when there are contraindications present. Also, perform a risks, benefits, and alternatives informed consent process with patients so they understand exactly what's going on and what risks are being performed for the procedure. Lastly, technical skills are required for this procedure. So if you are not trained and credentialed appropriately, you should not be performing this procedure. What are some of the more specific considerations for doctors, specific to attorneys, and specific to patients when considering the medical legal implications of the TEE procedure from the physician perspective? Make sure that you have correctly identified indications and contraindications, if there are any, to make sure it's used appropriately and not used when it shouldn't be. Learn safe TEE probe placement techniques. If you need more suggestions, check out Tea Time episode 4, where we talk about TEE probe placement and troubleshooting. Make sure you document appropriately what happened with the patient. Remember, if it's not in the chart, it didn't happen, is an old mantra in the legal space. Also, recovering risks, benefits, and alternatives with patients allow them to be much more involved in their care to make much more informed decisions. Lastly, credentialing and training are of utmost importance. Make sure if you're not credentialed and trained to use the TEE probe that you're not using it to make clinical decisions, as certain judgments can fall back on you if you make inaccurate assessments. How can you reduce your risk as a clinician when performing certain TEE procedures? The first element of this is asking, should the procedure even be performed in the first place, or are there reasonable alternatives like TTE, or are there other alternatives in the presence of contraindications that may warrant epicardial, epiaortic, ICE, or smaller probes to be used for echocardiography? Number 2, make sure you perform a thorough pre-procedure assessment. This involves taking a thorough history and looking at any prior imaging or EGD studies that the patient has. If needed, a GI consult can be performed to perform a pre-TEE EGD to rule out esophageal pathology. When you insert the probes, a couple quick tips: make sure to be extra gentle. You should never need excessive force to place a probe. Use extra lubricant. Stop if you feel any resistance. Use a video laryngoscope if you're having trouble at all, and make sure the probe is unlocked before you place it. Number 4, during the exam, limit any excessive movements, excessive manipulation, or duration of the exam outside of what you need to complete your assessment. Number 5, regarding personnel, make sure it's an experienced, trained, and credentialed operator that performs these exams. And number 6, be systematic about your approach to TEE, whether this involves checklists to perform pre-procedure timeouts or standardized exam and reporting or documentation protocols to be thorough with your assessment and documentation. When does transesophageal echocardiography lead to litigation? What are specific considerations attorneys should know regarding this? Well, the first one is knowing some of the contraindications for TEE, such as providers using TEE when it shouldn't be used. The next one is looking at indications, not using TEE when it should be used. A lot of focus is on harm with placement of TEE, but there have been significant cases regarding misdiagnosis or missed findings that were significant factors, the same way if a radiologist could miss a finding, that can cause problems as well. So attorneys need access to TEE images if they're performing cases involving these. Number 3 is their misinterpretation of images. The provider has lack of skill and clearly misdiagnosed something that was important. Number 4, the failure to identify complications regarding patient management. If a patient has subcutaneous emphysema, fever, cough, shortness of breath in the post-procedure procedure period. This should clue you into potential injuries to the esophagus during the procedure that may have occurred and should be further evaluated in the post-procedure period. Number 5 is the presence of inadequate documentation or even the absence of informed consent. Finally, was there poor technique used? Was there improper sedation or even the misidentification of some of those postoperative complications? And then regarding patient considerations, even though we've discussed a lot of the harm that can occur with this procedure, these are generally very helpful procedures that providers perform because they do give a more detailed assessment of cardiac anatomy and are especially important in certain cardiac situations. Also, they are generally very safe with a less than 1% chance of complications, and most of those complications being cuts or bruises to the lips or gums or the back of the mouth. Make sure your provider performs informed consent with you where they answer all your questions regarding the benefits, the risks, and the alternatives to the procedure as well. Let's review a few of the major takeaways that I want you to gain from this episode. For doctors, make sure you follow recommended indications, contraindications, and safe use techniques. For attorneys, did the provider heed these indications, contraindications, and safe use techniques? And was there even a misdiagnosis that could have led to the patient's harm? And then patients, just know these really are generally safe. These are exceptions that we're talking about when there's harm from these procedures, but make sure that all of your questions are clearly answered in regards to the risks, benefits, and alternatives of this procedure. The next episode, episode 19, will be evaluating left atrial appendage thrombus or clot using TEE. As always, thank you guys for watching. Feel free to hit that subscribe button and it'll bring you content as we make it. Also, if you have a unique experience or you have thoughts on this episode, feel free to leave a comment and let us know what you think about the show. And also, if you have any experiences you think would benefit other people to hear, leave those in the comments below as well. Thank you again for watching. We'll see y'all next time.